And Dr. Chijioke Kajuru is a public health physician, and he joins us from Abuja studios for more on the situation in Africa. Thank you for joining us on the program.
Thank you very much, Millicent. It's a pleasure to be here.
All right. We're seeing, lots of aids coming into Africa, but unfortunately, vaccine coverage remains low. What's your take on richer countries already using booster shots?
Well, I think there's some global recommendations that we have to look very critically at, especially for a national program that chooses to introduce a third dose of the vaccine or booster shots. I think it's important that we look at those global evidence and understand that we have to consider the strength of what we know around the benefits of the third dose and the booster shots, as well as look at its implications for the global vaccine supply chain, as well as for vaccine equity. What we're seeing playing out is geopolitics and vaccine nationalism at the expense of, so to speak, poorer countries or low and middle income countries, especially in Africa. Ultimately, some countries have the capacity and the resources to deploy a third shot or a booster dose of the COVID-19 vaccines, but ultimately this would just continue to prolong the outbreaks because this virus is smart, it's learning, it's mutating and changing, and the longer we have swaths of people who are unvaccinated, the more likely that there will be new variants of this vaccine that will potentially start to evade the vaccination itself that we have available, and that's something that should be a global concern for all of us.
Also, those vaccinated are still fighting the virus due to the Delta variant, but the problems are not just enough vaccines. There's also the low compliance and vaccine hesitancy. So if, for example, the African continent isn't getting enough vaccines, can we survive alone on just the non-pharmaceutical interventions?
Ultimately, the public health and social measures need to be complemented by vaccine uptake. And the good thing is that across board, the vaccines are safe, they're effective against all the different variants that we've seen of interest. And so we really just have to encourage each other to, take up the vaccine for those that are eligible. But again, we have recognized that the African continent does not have a challenge of vaccine hesitancy. We really just have a challenge of vaccine inequities and, inadequacy of supplies to us.
West Africa is experiencing a resurgence, according to WHO, and they identified low testing, especially among travelers. So if we don't test, how do we inform plans to tackle the virus? What do you think our data is really telling us about how the virus is hitting?
So, at this point in the pandemic, we have the strongest capacity for testing that we've had in the West African sub-region since the pandemic first started, right? And I think what we're seeing is a lot of low demand for testing across board, despite increased capacity for testing. And so it really behooves on all of us to continue to encourage each other, to continue to share messaging, to continue to generate demand for testing across board, because we really need to get tested. If people don't get tested, we're really not going to be able to contain the outbreak, or to be able to mitigate its effects on essential health services as well. So really, we need to continue to drive the demand for tests, because at this moment, we really do have the capacity to test more and more people.
So we're also seeing other diseases coming up, like the Marburg virus, the threat of cholera, the new case of Ebola in the Guinean National. Are we on track to reinforcing our surveillance measures, especially for West Africa?
I think that West Africa has had to battle on a number of infectious disease outbreaks over the last few years, and this has actually helped the West African sub-region build and advance its capacity for surveillance. We've seen significant investments in this surveillance architecture to fight and contain Lassa fever. We've seen that for cholera outbreaks. We've seen that even the West African Ebola outbreak as well. And many of these structures, as well as the polio legacy structures and the structures for HIV/AIDS containment as well, have all contributed to being able to work and contain COVID-19 in the West African sub-region. But of course, we continue to need to invest in these surveillance systems, to strengthen them, to continue to build one block at a time, because ultimately we will continue to suffer these outbreaks, and we're going to need all of these surveillance systems to be able to help us contain them and to help make sure that we mitigate its effects on all other essential health services and continue to strengthen our health and community systems.
Indeed. We would like to thank you, Dr. Chijioke Kajuru, public health physician. Thank you so much for joining us on the program.
Thank you very much, Millicent.